You have probably felt it before, a dull, nagging pain in the lower left side of your stomach. You told yourself it was gas or stress or something you ate, and then it went away, or at least you stopped noticing it. For millions of people, every year that exact moment is when the warning window opens, and they walk right past it. In the United States alone, around 200,000 people are hospitalized for diverticulitis annually. More than half of all adults over 60 already have the structural changes inside their colon that make this condition possible. Most of them have no idea. And the number keeps climbing because the modern diet and the way most people live today are almost perfectly designed to create this problem. And here is what makes this particular condition dangerous. Several of its warning signs disguise themselves as completely different problems. One of them in particular looks so much like a urinary infection that people treat the wrong thing entirely, while the real issue keeps getting worse. Before we go further, this video is for educational purposes only. It is here to help you understand what your body may be trying to tell you, not to replace a doctor's diagnosis. If anything in this video sounds familiar, take it seriously and get properly checked out. So, let us start at the beginning. Your large intestine is a muscular tube roughly 1.5 meters long. Its job is to absorb water and move waste toward the exit. For most of your life, it does this quietly without complaint. But over time, especially with a low-fiber diet or chronic constipation, the pressure inside the colon builds repeatedly. The walls gradually weaken, and when a weakened wall meets that pressure often enough, something gives. Small pouches begin to push outward through the weak spots. They are called diverticula. Think of a tire wall that develops a bubble under pressure. These little pouches are that bubble forming along the lining of your colon. Having these pouches is called diverticulosis. On its own, it causes no symptoms. Millions of people carry it and live completely normally. The problem begins when one of those pouches gets a piece of waste trapped inside it. The trapped material creates a blockage. Bacteria multiply. Inflammation sets in. The pouch swells. That is diverticulitis, and that is when your body starts sending signals. Here are the signs that should stop you in your tracks. The first sign is persistent pain in the lower left abdomen. This is the most common symptom present in more than 70% of cases. And it is also the most dismissed. People assume it is bloating or a pulled muscle or just a bad digestive day. But what makes diverticulitis pain different is this: it does not come and go in waves like typical stomach cramps. It stays. It sits there constant, like something is pressing from the inside and has no intention of letting up. The reason it hits the lower left side comes down to anatomy. The sigmoid colon, which is the final S-shaped section of your large intestine, sits in the lower left area of your abdomen. This is where diverticula form most often in people of Western descent. When one of those pouches becomes inflamed, the tissue around it becomes swollen and tender. Press gently on that spot and it will likely hurt more than it should. Now here is a detail most people do not know. In people of Asian descent, the pouches tend to form more often on the right side of the colon. So, the pain appears in the lower right abdomen instead, which can look almost identical to appendicitis. The key difference is time. Appendicitis tends to escalate sharply within 24 hours, often becoming unbearable. If the lower right pain has been dragging on for more than 3 days without that sharp escalation, diverticulitis is a much more likely explanation. The second sign is a sudden, unexplained change in your bathroom routine. When the colon is inflamed, it loses its normal rhythm. The muscular contractions that move waste through your system become inconsistent, sometimes too slow, sometimes erratic. For most people, this shows up as constipation hard or infrequent stools that feel like the system has stalled. For others, it goes the opposite direction into diarrhea, and for some, the pattern alternates between both within the same week. Here is why that alternation happens. The inflamed section of the colon creates a kind of partial obstruction. Stool backs up behind it, producing constipation. Then the colon responds with a forceful contraction to push through, which overshoots and produces loose, urgent stools. Back and forth. The body trying to compensate for a problem it cannot resolve on its own. This kind of shift with no obvious dietary explanation is your digestive system signaling that something has disrupted its normal pattern from the inside. Paired with lower abdominal pain, it adds another piece to a picture that is increasingly hard to ignore. The third sign is nausea and vomiting. These do not appear in every case of diverticulitis, but when they do, they carry a specific meaning that goes beyond simple discomfort, and they are easy to misread. Sometimes the nausea is the body's direct response to severe ongoing pain. That is uncomfortable but relatively straightforward. The more serious scenario is when a severely inflamed pouch swells large enough to partially or fully block the inside of the colon. Imagine pinching a garden hose tightly in the middle. Waste cannot pass beyond that point. It backs up. Pressure builds through the entire digestive tract above it. The body with nowhere to move things forward starts pushing back in the only direction available. That is what produces the nausea and vomiting. And unlike food poisoning or a stomach virus, this kind does not pass after a few hours. It persists because the underlying blockage is still there. If you are vomiting alongside persistent lower abdominal pain, that combination warrants medical attention, not a wait-and-see approach at home. The fourth sign is fever and a faster than normal heart rate. This is where the situation shifts from uncomfortable to genuinely urgent. In most cases of diverticulitis, inflammation alone drives a mild fever. Your immune system activates, your body temperature rises slightly as part of the standard response to tissue damage. That is expected and manageable. But there is a more serious version of this story. The wall of an inflamed pouch is already thin and under considerable stress. In severe cases, that wall can develop a small tear. When it does, the contents of the colon bacteria and waste material begin leaking into the surrounding abdominal cavity. The body responds immediately with a rapid and intense immune reaction. Fever spikes higher. Heart rate climbs. The area around the leak can form a pocket of infection called an abscess. If that infection spreads into the bloodstream, the condition becomes sepsis. Both are medical emergencies that require immediate hospital treatment. A fever that climbs alongside lower abdominal pain is not something to wait out with paracetamol and rest. It is a signal that infection may already be active inside your body, and the timeline for getting help matters. The fifth sign is the one that throws almost everyone off. You feel an urgent need to urinate, frequently, sometimes with a burning sensation. It feels exactly like a urinary tract infection. So you drink more water, maybe pick up something from the pharmacy and wait for it to pass, but your bladder is fine. Your urinary tract has nothing to do with what is actually happening. Here is the real explanation. The sigmoid colon sits directly behind the bladder in the lower pelvis. When a pouch in that section becomes significantly inflamed and swollen, it physically presses against the bladder from the outside. The bladder, receiving that external pressure, interprets it as fullness and sends the signal to urinate. You feel the urge when there is nothing there. The sustained pressure can also cause a burning sensation during urination that is, by feel alone, completely indistinguishable from a UTI. This is the sign that causes the most dangerous delays. People spend days treating themselves for a urinary infection. They feel no better. They try a different remedy. Meanwhile, the actual inflammation in the colon continues unchecked and continues to worsen. The way to tell the difference is to look at the full picture rather than one symptom in isolation. A urinary infection does not cause constant lower abdominal pain that has been present for days. It does not change your bowel habits. It does not come with a fever alongside that specific lower abdominal tenderness. If urinary symptoms appear alongside all of those things at the same time, the pattern is not pointing to your bladder. It is pointing to your colon. Now here's the practical takeaway this video promised you at the start. There are 3 signs that when they appear together mean it is time to see a doctor without delay. persistent lower abdominal pain that has not resolved after 24 hours, a fever, even a mild one, and a noticeable unexplained change in your normal bathroom routine. Any single one of them can occasionally have a simple explanation. All three together at the same time do not. Your body does not raise multiple flags at once for no reason. Diverticulitis is not a rare condition reserved for people with obvious risk factors. It is one of the most common gastrointestinal emergencies in the developed world, and it is becoming more common every year as dietary fiber intake falls and sedentary lifestyles become the norm. The majority of cases that turn serious do so not because the disease moved fast, but because the early signals were quiet enough to rationalize away. This is the part of human biology that most people never think about until something goes wrong. The colon does not announce itself. It does not send obvious alerts. It communicates in discomfort, in subtle shifts and patterns that only make sense when you know what to look for. You now know what to look for. A doctor can treat what they find. You are the one who decides whether they find it in time. If this video helped you understand something your body may have been trying to tell you, share it with someone who treats stomach pain as just another thing to push through. It might be the nudge they actually needed. Hit the like button to help this reach more people. And subscribe, because the more fluent you become in your body's language, the harder it becomes for anything to catch you off guard. Somewhere between the first quiet signal and the emergency room, there is a window. It belongs to you. Do not miss it.